And thank you very much, Dr. Nader, really for your support. I really appreciate that, your psychiatry.
You're welcome. No worries. We work as a team, so yeah.
Yeah.
Most of the stuff you do, so I'm just here for listening.
Yeah, really what you're doing really is really appreciated. And I think all of us, we do appreciate putting your name in our CV. It's a big value and add to us.
I'm happy to hear that.
Thank you.
Yeah, for me, I haven't had any word to express, what he did, for us.
Yeah, it is.
So
yeah, Allah bless you.
1 or 2 minutes, and then we will start. You need access to the screen, or you can share your screen.
Okay. Okay.
Oh, where is the other participant? They will join. Just wait, Slava.
I can wait. Yeah, can wait a couple of minutes.
We'll give them a couple of minutes. Yeah.
Yeah.
So in the meantime, do we have any update about any of the projects that we working on, or the application process, ERAS process? Any update from you guys?
Yeah, for us, like the response rate is so slow. Even those who respond to our questionnaire was doctor already we know.
Mm-hmm.
So I'm not sure how we can like fast.
Reach out to SAPA?
Yeah, I sent them message
Mm-hmm.
in the SAPA group, but nobody answered me. I'm not sure whether I should contact them via WhatsApp or what. But in their website, I try to message them like.
But I think personalized may be a better option. If you know someone, or WhatsApp someone.
Okay, I will do that.
Assalamu alaikum.
Alaikum salam, Lubaba. How are you doing?
Good. How is everyone? How is the season going?
For me, I got like maybe 9 interviews for now.
Good. I love the optimism. Keep it up.
Come up.
Keep it up.
You will get that number.
Yeah. Alaikum
salam.
I wanted 19 maybe. I'm not satisfied yet.
Go for it. It's Zoom, so it's not going to cost you anything at that time.
Yes. The more the better.
Yep.
I have 1 rejection till now.
Me too, actually. I celebrated the first rejection yesterday.
Oh, congratulations. I celebrate too.
Next one will be invitation.
Inshallah. Just keep the hope.
Hello, everyone. So we can start. Thank you for joining us. For those who will come later, they can follow up with the recorded session. So we will start. Dr. Slava, thank you. You're going to lead the team of the Zoom meeting. And thank you for participation and your effort, everyone. Go ahead. It's all yours.
Hello, everyone. Thank you for joining us for today's meeting. I will start with introduction of research methodology, and please feel free to unmute yourself if you have any question during my presentation. I will share the screen now. Can you share my screen? Hi, yes. Sorry. Can you share? Can you see it? Okay. Okay, so. Okay, so introduction to research methodology. This slides prepared by Dr. Hassan Mohammed Osman, and unfortunately he's working today, so he will be on and off. So I edited some part of it and I will present it. So the definition is specific procedure to identify, select, process, and evaluate information about a topic or a research question. It is based on the notion of scientific study. So for example, if we have some topic we want to investigate or reflect any observation, we would start by identify what is our research question. Sometime in qualitative method, we will not have like a specific hypothesis, but for other like quantitative, we should have a specific hypothesis to start with. So like the process is identification, collection, analysis, dissemination, use of information, and we will expand on each of these later on. So we begin with the research question or the study topic we want to pursue. So we should have, as I mentioned before, we should have a specific topic we want to address. What information will assist us in answering this question? If we take an example like nowadays topic, like COVID-19, if we want to do a research on COVID-19, I will see what is the research question or what's my hypothesis. For example, if I want to see the mortality rate of COVID-19 among diabetic type 1 compared to diabetic type 2 patients. So what information will assist us in answering this question? Like we need some death data, and we can get this from death certificate. Of course, we need also to know these deaths, how many COVID-19 among these deaths. So also maybe we will use COVID-19 notification system. So we should know from where we can get our information to specific research question. How would we go about collecting it? So sometime we can go, as I mentioned, to the certificate, to electronic medical records in hospital. So sometime I can have access to this information. Sometimes it's difficult. So I will use some surveys. And this, of course, not like for this topic. For other topic, I can use survey, questionnaire, and disseminate and collect data after that. And also, how would we present it? So there is many terms, so we should be aware of, like there is methodology and methods. Methodology, the theory of how research should be undertaken. This definition of methodology, but method, it is the techniques and procedures used to obtain data. So there is sometimes we use the term wrongly. For example, I can collect data without clear purpose, like I don't have in my mind a specific research question or a specific topic to address, and this can make some mistakes in my research. Reassembling and reordering facts or information without interpretation. Sometimes if I have, like, for example, hypothesis and I couldn't hit the point, or I found other result that I don't like believe on, it is not okay to reassemble or reordering facts to make my hypothesis right. So this is not acceptable. Okay, I would like just to shed a light on qualitative versus quantitative. So the qualitative, its goal to investigate a question without having a hypothesis in mind. A qualitative approach is more about diving inside than it's about making broad generalization that can be applied to large group of people. So we will concentrate on meanings without any like making many of data analysis or those process we make always in quantitative. Look for the big picture in each scenario. We can use a small sample and explore in depth over time. So no need for large sample size, and develop ideas through induction from the data. The quantitative research question usually contain hypotheses and or try to predict something. Concentrate on the facts and try to look for causality. So usually for quantitative method, I will have data, I will do analysis and measurements, and usually I should have hypotheses to test during my research. So I can use many approach, like descriptive. I can say like how much this, like my previous example of COVID-19 mortality among diabetic type 1 compared to diabetic type 2. So how much like the mortality rate, or how often, like sometime we need to address the timing. And comparative, what is the difference between? I can also compare between two groups. And also I can have like relation based, what is the relation between this, like the risk, and those who have risk and those don't have the risk. This is the famous table by 2 by 2. I'm sure all of you know this table from step 1, step 2, and some of you have step 3 already. So what to consider first, sorry, maybe I missed it, no. So what to consider first, sample size. Usually, whenever you have a bigger sample size, research will be more strong. You will have a smaller p-value, and that you can like support your hypothesis. You should have well-formulated question and interpretation, avoid ambiguous term. So if, for example, I will disseminate a survey or a questionnaire, so my question should be like straight to the point. And also when I do the interpretation, I should do without any ambiguous terms. Avoid open-ended question, as it is difficult to quantify. Like during our practice medicine, it's better to ask open-ended questions so you will not guide your patient towards a specific answer. But here, it will be a problem if I'm doing quantitative method, because it is difficult to do in a scale. So better like I'm using yes, no answer, or agree, disagree, strongly agree answer, or just give option for the answer. So after that, it will be easy for me to do my analysis and report. Also software skills. In quantitative method, I should know one of software, at least one of them, like SPSS or SAS or R. Many software can calculate for you the ratio or the rates that we are interested in. So before starting our research, we should have also some software skills, knowledge of statistical analysis. So if I don't know how to analyze my results, I cannot make any inference about this result. Okay, so again, like I mentioned this before, just to wrap it up, the research process: formulating and clarify a topic, reviewing the literature, designing your research. So for our research, we should review some literature. So I will support for any like points I address, I should support it also with some literature before talking about the same points. So I should make the review of the literature first before I start also writing it up. designing research and collecting the data and analyzing the data, of course, then writing up my research or article. Okay, there is certain factor to consider here. The impact of personal beliefs and feelings. Sometimes I like, for my example, I have some like certain medication, I believe on it during my practice, during my even with my family experience, but I cannot infer this belief into my research. This would be not right, because we are not built our research on personal belief or feelings or just observation. Access to data, time and other resources, validity and reliability. We should also, if we test anything, should be valid, reliable, also generalizability. If we want to generalize, for example, I made a randomized control trial on some medication. So I did it on African American, and I found a great result with this medicine. I cannot generalize also to all population unless I have tested in different races. And of course, ethical issue. So confidentiality and all parts of ethics should be preserved during my research. Okay, so remember, there is no one best way of undertaking. We should keep try and try. So any question? I will see the chat. Oh, agree. Okay. So any question? Feel free to unmute yourself if you have question.
Excellent presentation, Dr. Salafa. Thank you so much for sharing.
Thank you,
This is quite helpful and very concise, very important topic. Thank you for sharing. So, hopefully this will help you guys identify areas where you can work on your project and develop the method and analyze and then present. So, excellent. Any questions? If no questions, you can proceed to the next. Oh, Dr. Al-Wali has a question, I think, or comment, please.
Yeah, first, thank you, Slava. It's a great presentation. Just my concern is, I'm not sure it is just kind of adding more, or so regard the validity of the study. So like, as we all know, like, so we kind of validate the study itself, and then how far we're gonna just like apply on the general population. So for validity of the study itself, regarding like study design and exposure and outcome, or even like intervention or whatever. And then for the external, like, so the representative of the sample to general population. So you have to make sure, like, so we do a study, for example, for a female exposure or intervention in a female population, and make sure that's like it's gonna be like inferences on the general population. Thank you.
Thank you, Dr. Wari, for the great point you shed a light on. Yes, so like we have internal validity, external validity, and on our research. And as you mentioned, like example, if we have a research on a female, sometimes we cannot make inference to the general population, including males. So yeah, I agree with you, and this is great point you mentioned. Thank you. Any other question or comment? Like anyone want to add anything? Just this like was introduction, but I'm sure it needs like more than 2-3 meetings to address all the topic.
If no questions, then we can go to the next section.
Okay,
Next
so okay, thanks. So Dr. Hiba and Dr. Mohammed will do interview practice. So yeah, feel free, Dr. Mohammed and Dr. Hiba, to unmute yourself and start.
Just give me a second. I'm trying to put myself in the middle. I'm struggling to do that. This is with the pen.
Yeah, you are in the middle.
No, but still there is a bar. I think I just gallery speaker.
Sure, but take your time, and I will send the link for.
Oh yeah.
The in the meantime, for all the group, if you want to download it, it gives like 1 month free access. So I send it to the chat.
Okay. I think I'm ready.
Okay.
Good afternoon, Dr. Abu Alama.
Hi, how are you? Thank you. Thank you for having me.
Yeah, nice to have you today with us. I'm Dr. Ibrahim, faculty in the psychiatric program here, and I will be with you for the next 20 minutes. We're going to ask you some questions to know more about you.
Sure. I'm happy to be here.
Yeah. And feel free to ask any questions that you have, okay?
Okay.
Okay. I went through your applications and I see that how much effort you put there to get the opportunity and to have the interview chance today from our program. So first, I would like to know more about you, and particularly if you mention things that you are not included in your application.
Sure.
Okay.
So, okay, I'm gonna give you just a little background about me. My name is Hiba Alama, and I'm originally from Sudan. Sudan is a country in East Africa. This is where I born and raised and had my medical. I finished my medical school, and also at the same time having a 1 year in training with the Sudanese Federal Ministry of Health. And this is where I built, as they say, my basic stone to be to practice medicine. And after that, I moved to Saudi Arabia and I work as a general practitioner in a private hospital. It was one of the top hospital in the region. This is where I gained my knowledge and my clinical confidence in treating patients independently under supervision of highly qualified patients. After that, I moved to the United States here, where I started my journey toward practicing in the US, and that's by taking the USMLE exams. And at the same time, I finished the certificate of public health from University of Colorado. And now I'm upgraded to MBH epidemiology. And also I'm now enrolled in a telegeriatric fellowship, a research fellowship at Michigan State University. And on a personal level, I love do cycling and go for running whenever I have the chance and spend family time.
Great. You are so busy. You have so many things that you're doing at the same time. And how do you manage your time to do all of that?
Actually, just to organize my task, that will work definitely. I love to do like prepare a schedule in advance for everything that I'm doing. So that make me hitting my task on time.
Okay. So, Dr. Abualama, why you choose psychiatric as a future career, and why do you think it's the best fit for you?
Okay, that's a great question, actually. During my career in practice, I found that speaking about mental health is something people avoid, and they feel it would get you immediately stigma if you just speak about it or express your feeling that you have you're suffering or your emotion is not right. So I try to observe that it was evident in the workplace, it was evident in the community based that the stigma. So I become more interested in understanding why people think that way and what's burden is on those who already suffer from a psychiatric illness. And from here, my passion to psychiatry started.
All right. And why do you choose our program?
Actually, your program has all the elements that I'm looking for, which is the culture, and that's through the supportive environment you have, and that's through a resident in your program. They really agree that the program is supportive and it's encouraging the residents to do and take elective that they really see it um, could improve their skills in management. And at the same time, the locations I want to live in a big city, I could say.
Okay.
Besides, of course, the strong curriculum that you have already.
All right. And can you tell me about your weaknesses?
Oh, that's a great question too. So I can say my weakness as a foreign medical doctor is understanding the fine details of the culture fine details of the American cultures. And to improve that area, particularly, I enrolled in many volunteers work. One of them with the youth, and one of them was empowering women who suffer from domestic violence. And having this experience, beside also externship and observership, give me an insight about the norms of the patients and the sensitive topics that the patient could see it violating their privacy, I could say. So I'm working on that and understanding more about the American culture.
Okay. So what points that make you a good fit for our program?
I see myself as a resilient person and I highly adaptable. I moved from my country to another country and I was able to adapt and stay there for 4 years and making friends and engaging with the community. So I'm seeing myself as a person who can adapt in any environment. I can adjust immediately and at the same time, teamwork. I learned that the value of teamwork through my other experience in the medical field and how that impact the patient outcome. And at the same time, I see myself who's learning, a fast learner. I learn from my surroundings so quickly, and I adapted to my goals and my career.
Great. What challenge do you think this specialty may face in the future?
Uh, uh, actually, we will keep challenging the stigma around psychiatric, and even in the medical field itself, being to select a psychiatric as a specialty, like everyone, like, why do you do that? Like, oh, so I think the stigma, it will persist, I can say. That's the challenging, what we will face, that we will face.
Okay.
We will continue to face.
All right. So now we're going to go move to the behavioral question part. So can you tell me about the conflict with one of your colleagues and how you handle it?
You mean an example? I don't see a conflict usually in the workplace where people where I work, we work as a team. Sometimes we disagree in a point of view. So I remember this one day we just disagree about the management of a patient's plan, and at the end it wasn't a conflict. Again, it was a disagreement, and we solved this by just providing evidence which work best, and we just solve it. And this is something could happen on a daily basis. I don't say a conflict, I say disagreement in point of view, and we will just try to clarify it by showing evidence. And at the end, both of us, we want the benefit, we want the best outcome for the patients. So we do agree in that point.
Right. So, can you tell me about the difficult decision that you have made and why?
Pardon me, can you repeat that question again? I didn't hear it.
Okay. Tell me about the difficult decision you have made and why.
A difficult decision that I made and why. I think of is that taking my step one in certain months, and it's a difficult decision because it's shaped my life right now, and it's evident that it is important, and I didn't reach out to have more information about. I can say I see it that way, and also I didn't learn about the techniques well. I thought at that period of time that I did the right decision to take it, but it come out no.
Okay. So do you have like any red flags in your applications that you feel you can reflect them as positive points for us?
Could be the graduation years. People, they say they see that graduate the old you the old graduate you are, the weak chance that you may match. But for me, I see it from different perspective, that this is a strength, because I already have been through this tough situation, and I want to repeat that experience again. So that's confirmed that I'm a strong applicant to go through all this process over after being licensed in other country and having a career. But I think that just confirmed that I'm a dreamer.
So do you have anything that you feel that you're going to share with us?
For now, I don't feel like I have particular something to share extra, but I would like to ask questions about your program. So how do you define your residents as that they achieve their high level? How do you evaluate your resident and give them the title of a chief resident?
So we have like surveys we do every year for from BUI 1 to BUI 3, and we have like regular meetings with our faculties to evaluate our resident in our program.
Okay, thank you for answering this question.
Okay. Okay. Thank you again, Dr. Abu Alama, and thank you for having us today. And I wish you the best in the future endeavors.
I appreciate this, Chan. Thank you very much and hope to be part of your team. Thank you.
Bye-bye.
Thank you, Hiba. Thank you, Dr. Muhammad. A great interview. So for our folks, if you have any comment, any question to Hiba or Muhammad,
Dr. Al-Bali, I think, has comment or question. Go ahead. Followed by Dr. Selma.
First, it's great presentation, Mohammed. Thank you, Mohammed and Hiba. Just I have like kind of two comment, and anyone can correct me if I'm wrong. So the first one, like that's great question. So they said like in this kind of interview question, it's better to rephrase than grading the question of the interviewer. So you can say like, okay, or you can rephrase the question in your own words. It's better than grading the question from the one who interviewed you. The second, adding to what you mentioned, and it's really great. So when he mentioned that why you find yourself in this program, I can just rephrase the question as he said. But you can adding more that like, I think it is two part. First part, you can talk about yourself, how you find yourself fitting. And at the same time, you can take a part of his program that I go over the curriculum, and I see your program kind of like similarity with what I want or what I like about, things like that. Thank you again.
Thank you, Dr. Wali.
thank you, Dr. Wali. And Selma Ali, she has a question.
Hi, assalamu alaikum, everyone. First of all, great interview, Hiba, and so one question that I had was, and this is for everybody, at the very end of the interview, you're usually asked, do you have any questions for us? So online, a lot of people say, if you have a genuine question that's going to help your case, go ahead and ask. If you're genuinely curious and it's not answered on their website, then go ahead. But otherwise, it's best to not ask questions and say, I don't have any questions currently, but if I do think of something, I'll reach out, via email or to your program coordinator, because, the faculty has to interview hundreds of people and they're not really, interested in hearing all these questions. So that's my question for everyone, Dr. Nader. My comment on Hiba's strategy on stating, for example, what makes me a great person is I'm adaptable. It's very important to always follow it up with an example. I'm adaptable because so-and-so happened, and, I moved around a lot, and I did this and this, and this has always helped me to adapt, So it's always very important to give an example when you're describing yourself with a characteristic or a feature. The second point is, whenever you, the question to her was, describe an area of conflict, and she said it's not a conflict, it was a disagreement. That's another excellent example. You don't say things like, we had a conflict and I did this and this. No, you say, opinions vary within the department, and with effective communication and regular staff meetings, we managed to resolve it. So it's always better to stay away from negative connotations or words like conflict, disagreement, stuff like that. and phrase it in a more positive sense, if that makes any sense. So yeah, that's all I wanted to say. Thank you.
Thank you, Salma. Thank you. Appreciate your comments. That's valuable.
Yes, thank you, Selma. And I also agree with you. We should check on their website before we ask. If the question is already answered in the website, we will not ask again. Any comment to Selma points, or we will move to Azza? So Sarah, Dr. Sarah Abdel Jawad in the chat, she said, try to sell and express yourself more in Tell Me About Yourself. Okay, so like for how long do you think it should be like she should talk about herself? $60 minutes, sorry, 60 seconds
It's 1
or
to 2 minutes.
90. 60 minutes will be a lot.
1 to 2 minutes. I try to make the questions not the regular way, and as I ask her to tell something not in the application. Yeah, she shows something from the application, and for like 30 to 40 minutes, and the rest she should bring something out of her application.
Okay. Dr. Selma also mentioned should be 60 to 90 seconds. So yeah, 1 minute to 1.5 minutes. Okay. Any other comment before we move to Azza?
Yes, I have comment, please.
Yes, sure.
I think it is a great interview rehearsal, great mock interview. But I have want to support what Dr. Al-Wali said by Dr. Hiba is before she starts answering the question, she comment by saying that's a great question. I think this may not be proper if you are facing an attending or a chief resident. Yes, you can say, you can repeat the question and answer it in the following to the question, but not to comment on the question itself. I think it is not good. On the positive side, Dr. Hiba, I think you did a good point, good issue by asking questions, because in interviews they already say that you should make the habit of asking questions to the interviewer. This is good, and I support it. Thank you.
Thank you, Dr. Khalafallah. Okay, so Dr. Azza, please go ahead.
Hi, everyone. Thank you, Dr. Mohammed and Dr. Hiba, for the nice interview. I guess we all need to practice. And the most common question is tell me about yourself. I think you did good. One of the most things that we tend to do when we ask, tell me about yourself, is to recite our CV. And I don't think they want to hear our entire CV in Tell Me About Yourself. It's going to be a little bit boring, but we are tempted to say everything in the CV. I think if we focus more on the skills that we have, the experiences and the achievement, and what type of person that we are, is to cover the 1 or 2 minutes in the Tell Me About Yourself will be great. And of course, not mention our name and obvious things like that. But in general, you did great. One more question I think I want to ask Hiba is, why did you want to pursue a residency in the United States while you are already been practicing overseas? One of the obvious questions. One more thing, I think they welcome the questions. Anyone, like, you should prepare more than 2 or 3 questions for the faculty. It's always welcome, but you try to keep it engaging. And if he mentions something that you want to ask about and already be mentioned, just check that question out. And I think, yes, you overall, everyone did great. Thank you.
Thank you, Azza, and that's a good point. Actually, this is a very common question. Why do you want to pursue a residency here while you already had a career elsewhere? That's true.
Okay, Dr. Wiam. Thank you, Dr. Azza, for your comment. And next, Dr. Wiam, please go ahead.
Yes, Assalamu alaikum, everyone. Thank you, Dr. Hiba, for this mock interview. That was great. I have few comments and tips. Maybe inshallah is going to be helpful. I think I did 2 interviews in psychiatry before. So the first thing, thank you for your smile, mashallah. You carried your smile all over the mock interview. That is really, really good, because no matter how many mock interviews you do, it is very, very stressful when you in the real interview. It's really it's intense. In the time that you're sitting in that chair, you'll be like really, really under like a lot of mixed emotions. So carrying your smile is really good. Alhamdulillah, I did this. My other tip is in mock interviews, we usually be exactly fully prepared, just like we're doing the interview. We come with our full suit, everything. This actually puts you in a mood, in a different mood when you're wearing your actually what are you going to wear in the interview. This is very helpful because it puts you in a really different mood, that you're actually in an interview and you're taking every single thing seriously, not mean like you're taking it like the real thing. When they ask about tell me about yourself, because a very tricky question, although it looks like really straightforward, I like to divide my answer into three main categories: is the past, the present, and the future. The past, we talk briefly about the main highlight of your previous, like, your education and everything. And then the present, what you're actually doing right now. And the future, you show your vision as a doctor. Yes, you're seeking this residency, but there's a vision that you're seeking in your life. Like after you finish your psychiatry, you're actually doing this for a goal. It's not only a job. It's actually you're seeking a goal or a vision in your life to accomplish. And you can do this really briefly in a minute. You can actually talk about all these 3 things. My colleagues also said about commenting about the question. Instead of saying that's a great question, you can say thank you for your question. Because you feel, well, you say thank you for the question, that you mean you're prepared. This is one of the questions that you are prepared to answer. Also, when you ended the interview, it kind of ended abruptly by saying like, I have questions, but you didn't wait for the interviewer to say if he wants to ask a question or no. I mean, you didn't ask for permission, which is usually you wait, like, I have some question, please, and then we'll tell you great. They will usually say that's great, go forward and ask for the question. One more thing is, when you were asked about the conflict between you and somebody in your team. Usually, I don't know, I have a feeling that they want more detail from you. Like, you don't want to give them a generic answer that there was a conflict and you solve it. If you actually provide some more detail, it will be more sincere. Like, okay, there was actually a question. You're not making things up. Like, it's not a generic answer. You can tell them little bit detail, that this happened and I did this and this is how I I try to solve it, and this was the actual result. So if you give some more detail about the story, everybody likes to be engaged in some, like to hear some story that's like really sincere. I think that's about it. But also, there was a great mock interview, and good luck for everyone.
Thank you, Ram. Thank you for this valuable comments. But for the disagreement or the conflict, I don't have a conflict with a colleague. So I just see things as we could have different opinion in management of a patient, and we come up to a decision. We are all agree. Yeah, okay, that will help the patient to become like to get well. So and it's not. We're not gonna fight.
Yeah.
I didn't have a fight, a real one.
Yeah, you should say I didn't have any conflict that
A
I
real
know of.
fight with anyone, but on a daily basis, we do disagree in opinions, and this is part of the normal life. I can say different opinion. So we respect each other by just we just see what's come to the benefit of the patients, but otherwise. I don't really. I need to think about how answering this question. I just try to make it generic because I don't.
Yeah, I think you should say the truth. Say I've never had any major conflicts, but if I have in the future, I will do this and this and this, because this will actually reflect that you're actually a really flexible person, and you don't take any kind of thing like seriously, like it's a serious conflict. You're actually really flexible. You're really good at managing, or you have a high people skill that will reflect actually your personality. That's really good to say. I really did not have any major conflicts with anyone. I'm usually, I'm really, I have like, I'm really flexible and with people, and I don't feel like these are conflicts. I feel like this is a really daily based disagreement, and it just the day pass by, and it's done.
So yeah, when someone correct me in their workplace, I don't personalize things because
yes,
at the end he wants he wants the patient. We want all the patient to be in a good hands, even me or my colleague. So yeah.
Yes, mashallah, this is a sign of a really high emotional maturity, which is really to your side. This is a good thing.
Okay, thank you, and thank you for the other comments. Really, that's appreciated, guys. I'm having a free coaching here.
Yeah, I think you're doing really good, mashallah.
Thank you so much, Dr. Oyam, Dr. Hiba. And Dr. Lubaba, please feel free to unmute yourself.
Okay. So hello, everyone. For those who joined late, I just want to start that with Hiba. You actually did a great job. You did excellent. I love the confidence. It was like, I echo what Wiam said, you carried your smile the whole interview. It was really great. Even in my small talk, I feel like my heart is beating and I'm hearing it, but I did not notice anything on you. So I want to salute you for that. You did excellent. I'm not gonna repeat what all of my colleagues mentioned about talking about myself or tell us about yourself. So you want to avoid repeating what is in your CV and keep it short. For all of us guys, we are all grads. Most of us work in 3 kind of continents. This is really strong point. We have to add that in our tell me about yourself. You say like, I had an experience, or I have an experience across 3 continents. You worked in Saudi Arabia, you worked in Africa, in Sudan, and now you are here doing some kind of research work, and you are doing clinical experience. You want to highlight that instead of talking about details, what you did after graduation, because that's available in the CV. Try to keep it short. I'm going to disagree with my colleague regarding talking about your, before that, your weak point is really great. I love it. That's the culture for the American. You are willing to know that and learn that. This is really nice weak point that you brought it up, and you made it like a very strong point. Actually, you are somebody adaptable. You mentioned a lot of qualities and characteristics of yourself. I would like to hear those in there. Tell me about yourself. You are adaptable person. You are resilient. You are a fast learner, and you are open to learn new cultures. So all of this, you can mention them and tell me about myself instead of talking about the details about your work. The point that I'm going to disagree with my colleague talking about conflicts. I like the way that you approach the question, and you said it's not a conflict. You can tell that at the end of the day, we all are human beings, and we are prone to mistakes and conflicts and disagreements. So you can say that I am having, for example, minor demeanor or something. I'm not getting into disagreement a lot. I just want you to avoid mentioning patient care, because people or experienced resident have been in a lot of troubles because they've been practicing for years, especially for all graduates. So if you mention something about patient management, that means you might be a difficult resident that already had the experience. You're going to challenge the attendings. You're going to challenge the people that younger than you with your opinion. And so avoid mentioning conflict in patient management. Talk about anything, teamwork, schedule, stuff like that. Disagreement in different areas, just avoid patient care. The other thing that I love your passion regarding psychiatry and why you are interested in psychiatry and the stigma around that. You can talk about the stigma in our countries, that what brought you to this. And I would like to hear an encounter with a patient in psychiatry. What happened? How did you solve them? And how did you reach that there is a stigma? Knowing it is a stigma from your growing up is not as strong as you facing it as a practicing provider. So find some of the patient that you took care of them and you felt like they were not, for example, coming early for the treatment because of the stigma, and how did you help them, and how do you realize that this is area that you want to help people about it. And I love that you are involved in the women violence and all of this kind of stuff really in the market now in the US. But overall, you did excellent. I salute you and well done. Great.
Thank you guys, really. Thank you, Lubaba. Everyone, really, I'm having a free coaching, as I said, and this is valuable for me.
Great.
Having all this comments.
Thank you so much, Dr. Lubaba. Thank you, Hiba. And next, Dr. Sarah Abdul-Jawad.
Yes, hello everyone.
Hi,
I'm happy
Sarah.
to be there, and you did great, Hiba. You so lovely and friendly. Keep up, a little more confident. I like how you were concise and professional. But I want to add a little something that psychiatrists or program directors like dedication. I mean, what I can add on my colleagues that you can talk in any, you can take a chance in every question to speak about your dedication in psychiatry. Okay, I was providing psychological support when when you are working in Saudi Arabia or in Sudan. If you're looking forward subspecialty related to psychiatry, if you provide excellent care or good care to patients who need to have special psychological support. Of course, you before that you had an experience with refugees or women under domestic violence. As you said, you can have an example talking about the psychiatric impact. Try to show dedication to psychiatry in each word as you can. So even like such a support, just a support. So yes, that's what I wanted to add. And Wish you you can achieve your goal, inshallah.
Thank you, Sarah. Thank you. Appreciate that words.
Thank you, Dr. Sarah, for your valuable comment. And Dr. Mohammed Tijani, please go ahead.
Assalamu alaikum, everybody.
Salam.
Thank you so much for this great presentation today. Thank you, everybody, for their comment as well, which make my mission kind of a little bit difficult to talk after all these great feedbacks. I just want to highlight one or 2 points here. So based on what we've been through for the last 2 weeks, talking about interview skills and how to address interview questions, one of the greatest questions each one of us basically having a debate or kind of a challenge to answer was, tell me about your weakness. Now you added to that list, should you comment on the question first or not? So I wish if we can have more discussion about this part, because every time I'm watching TV show or interview, I see Americans love always to comment first about the question before they try to answer it. But which way should we go? Just saying, okay, thank you for the question, or wow, this is a great question, and then you try to answer. So wish we can have more debate about this. That would be great. Thank you so much, everyone. Really great meeting today. Thank you.
Thank you, Dr. Muhammad.
Thank you, Dr. Mohammed Tijani. So is there any other question or comment?
Can I comment on Dr. Tijani's question?
Sure.
I think, if I'm not mistaken, people tend to comment on the question just to give them a chance to think about their answer. Like, you know, nobody, everybody needs to prepare a little bit, you know. So instead of just being silent, they try to say something, or just to have this break. Just give me a little break so I can think and answer this question properly. So it's just a break that you get. But you're right. We should come up with a good phrase that, first of all, it's not gonna offend the person who is questioning. I know, because if I'm not just exaggerating, but people here have pride. They have pride. Once you touch it, they don't like it. So like one of my colleagues said, don't grade the question. I think we should not grade the question. This is a good question. But we should have a break. And sometimes people make a joke and everybody's laughing. And this is a good thing to change the atmosphere. But we should, I think you're right, we should come with a phrase or a question or something to gain this goal, getting a break before answering, but we do not want to trigger that reaction from the interviewer. So yes, I think we should talk about this more.
Thank you so much, Victoria.
Sorry, can I comment?
Yeah, sure. Sure, Azza, go ahead.
Okay, thank you, Mohammed, and I totally agree with you. I personally would not grade the question. I would not say this is a great question, this is a good question, but maybe I would say thank you for asking me this question. But I would like to hear from Dr. Nader. What do you think if you were if you did an interview, and is that kind of response is acceptable or not?
Yes, لا يفتى ومالكم في المدينة.
Thank you. Thank you, everyone. So let me start back with Hiba and Mohammed. Thank you so much for the great mock interview. You did great, and I think the best thing you did is you kept the smile, you kept your composure. Although I did not give you the Ativan, we said we will give you, so you can do it without the Ativan then. So regarding the last question or the point raised by Mohammed and the others, I think you can divide it into two parts. So what happens during the interview, they will give you a list of questions. Let's say there are 10 questions or 5 questions from one person, let's say the program director. So if he comes, he has a list of 5 questions. They will start with one question. The first question, usually you will be a little bit on the nervous side. So you don't know what the question is coming to you. So in that moment, I think it's good to thank the program director for the great question. So you will say, thank you so much for this good question, or for the question, or for this great question. Put it in a format where you want to stress the thank you part of the question. You can just say, thank you for the opportunity. And then you can answer the question according to hopefully you will have this question in your question book where you have an answer written, where you saved it in your mind and you are ready to just verbalize the answer without any hesitancy. This will give you the first part of your confidence. So the first question, ask thank the person for that question. Then there will be, let's say, the list of the question will be 4 questions more, right? So at that moment, then you will have the opportunity to identify which question you need to spend some time answering that question. Let's say they will ask you, okay, in your CV, it seems you went through difficulties, or in your CV, you work in Saudi Arabia. Tell me more about that, or whatever question among the 4th question that you might have a little bit of your answer might be there, but you want to polish it or to adjust it to the question because the question was not direct according to what list of questions you have. In that moment, then you will have what Hiba was mentioning, the breaking point where you want to take a break and think about it. And you can do this a couple of ways. One of them is you repeat the same question of that form the same question in your sentence, in your own words. So about Saudi Arabia, my work there, this is really interesting because it's a good experience there. And then during this period where you repeat the question, where you added some component to that question, you think about the other part where Wiam was mentioning. You have the experience, you can give the answers that you already have, but you are thinking to add, let's say, a personal part to it. So that way you will say, rephrase the question and add component to that question, like, this is really great because, you know, when I work in the Saudi Arabia, the culture was different, whatever, then you incorporate your answer during that process where you repeated the question, you rephrase the question, and you mention the part where you think that the question is great because it about your answer, which you want to put in a way that you convince the interviewer that the question is important and it touched part of your life where you want to explain more. The third part, what you can use actually is a silence part. So ready. Then give you the question right away. So you will play the students here how to do interview skills with patients. So we call it patient-centered interview. It's a new way of handling patients. We teach medical students, we teach residents. This was done by MSU, 2 physicians about 10 years ago. They come up with this approach where they will teach you how to nod to the patient where they are talking, how to give them a space and like a silent period, how to repeat the same, not part of the whole sentence, but the last part to engage them in that discussion or interview, and how to say, aha, this kind of word to improve your listening, or you show that you're listening. So the pause part or the silent part, you can use this to actually show the interviewer that you are thinking about the question. It's kind of, I'm thinking about the question. Although you already have the answer, but you want to play a trick that you are acting to show them that it's an important question. So kind of let me think about it, and then you give the answer. This usually happens when they tell you, tell me about a story, or tell me about something happened to you or some, then you will say, yeah, I remember, and then you give the story. So this part of silence also might be a way of a trick when you have the answer ready. So you want to show them that you are thinking about the question by just silence. I hope I answered your question, Mohammed, Tijani, and the rest, Hiba, and all. So use some of this technique to address. So give them the space, give them the thank you note, give them the, not grading the question, but mention it's like an excellent question or something as a comment after you rephrase that question, and as a pausing tool for you to think about your answer. Use silence as a way of displaying that you are thinking about the question, although in fact you don't, you are not thinking about the question, you have the answer. And then more thing, I think, Hiba, you try to incorporate this, and I want you to do it more, and every one of you, is highlight some of the personality keywords that in your, whatever, if you want to speak about yourself. So you don't have to answer the question, tell me more about you. You have to inject all this quality of your personality in each and every question that you answer. You have to mention that, yes, and with this, I think I'm a team leader because this is what happened, and so. And in another question, you can also mention that I'm persistent, and I follow up on whatever question, or any quality that you want to let the program know about you. You should highlight all these qualities in your answers. One more trick. When you answer the question, you did great, Hiba, by the way, but the trick or the tip that you want to also add at end of some of your answer is what we call the bit, where you want to give some sentence at the end where it has a content that may be of interest to the question and the program director or the interviewer. So you end the last comment of your answer with something like, and this also opened the door for me to learn something about other languages when you're talking about culture, so that you can mention. And I found that different communities speak like the Spanish language as a second language, and this I think of interest. So when you put it at the end, they will say, oh, what interest are you in Spanish or something? So you will say, oh, I think it's a good idea to learn something about Spanish language, and it will help, or whatever. That part, if you are ready to mention something about an activity that you are working on, let's say you are working on learning Spanish language, something like that. Or you have something you want to add, but you don't want to add it right away. You give it to them as a bit so that they can follow up where you want them to, kind of, you're leading them to areas where you want them to focus on. Sometimes it helps, sometimes it won't. So try it. Give it a try. It's a long answer. Hopefully it will help you.
And no, actually, every comment by you and by my colleagues is really meaningful because we need that to reflect. Usually I'm someone who's speaking with his hand, and if you see me in this interview, I was stiff. So this is something also I notice myself. Yeah, we just keep practicing, making feedbacks, and practice with each other also will help us. So look at this, all comments. Amazing. Thank you, guys. Thank you, Dr. Nader.
Thank you so much, Dr. Hiba. Thank you so much, Dr. Nader. Yeah, it was great mock interview, Hiba. I learned a lot from your answer. I will cheat and take some of your answer in my future interview. Okay.
Actually, taking this is okay, I think, to take from each other something that we may find for the culture things. This is one of the attendee, like he told me, what do you feel like really your weakness? I said, my communication skills maybe with the American people, sometimes I don't understand what's their norm. So he said, why you don't say it in a way that, reflect that you're somewhere aware about your surrounding and you feel that this is your weakness, and just address it in a beautiful way that you work in it. You're asking all the time, like, how do I communicate with patient here? What's the sensitive topics that you have to address it like gently? So honestly, sometimes work and taking from other people thoughts is also, work too.
Yes. Okay, thank you so much. Also, Dr. Ala Abdasamad mentioned in the chat, you can say it's my pleasure. I'm glad answering your question. Thank you, Dr. Ala. Okay, no, I will see if anyone raised his hand. Okay, so we don't have any in the chat. So
So if there is any more comments, or actually, Dr. Sam and is it Muhammad Tijani still? If you have question, you can go ahead. Otherwise, you can lower your hand. Osama, Dr. Osama, go ahead.
I think the answer for this question of grading the answer. I think all the answers are correct. So if we put it like not to repeat ourselves to say that is a good question, that is a great question every time. So I think it's better to use all this model of answer. So like rephrasing of the questions, silence, as Dr. Nadir said. And sometimes you can say that this is a great question because it is not wrong, but some people do it in the interview. So I think the answer for this grading of questions, so all of them are good, but I think we don't have to repeat ourselves to say one phrase every time. That is my idea.
Totally agree with you. Thank you so much for raising this important point. Yeah.
So if you guys allow me to ask one last question, I promise, which is Dr. Hiba just triggered. First, thank you, Dr. Nadir, for the highlight. I really appreciate it. My question to Dr. Hiba, what she already triggered to open for discussion, to which extent you can use your body language. You don't want to be stiffy, as you just mentioned. Meantime, you don't want to be a clown, screens. Everything is virtual, right? But to which extent you can use your hand, you can use facial expression, you can use other kind of body language. Feedback on this area also can be really helpful for each one of us. Thank you so much. And I promise this is my last question. So.
Thank you, Dr. Mohammed. And yeah, we are happy for all your comments. So don't hesitate to ask again.
So I'm just gonna jump and answer that question. I don't have like the right answer maybe, but this is my guess. So you can use your hand when you want to emphasize a certain point and you want someone to focus with you. You can use your hand, not all the time. So I'm doing like this circle. You can do. There is a lot of lectures about body language, but I think when we want to emphasize a certain point and to highlight it, we grasp the attention of the other who's listening to us when we use our hand or our, as I'm doing right now, like I make it feel like interesting to you, like not like being the same effect, just smiling and talking. That's my opinion. So please correct me if I'm wrong. Oh, sorry.
Any comments or any answers to Muhammad? So I'll jump. So basically, I agree with Heba. So when you are trying to make your answer vivid or clear, sometimes your body language might come into play and make things better. Let's say you want to focus on 3 points. So when you mention, I have 3 points, when you raise your fingers, or for instance, 1, 2, 3, it will make sense for the people who follow you that you still have 3 points instead of I have 3 points and then you raise your hand with 2 fingers. Kind of, it doesn't make sense, right? So when you use your body language, use it when you are focusing on certain part of the question. And it will come with practice also. So as long as you practice more and more, you'll find you want to focus on certain part of your answers using different ways of body language or hand gesture or some. So it's important to use it. It's tool like your smile and you are looking to the camera and all these, just you add it up and you practice with them. There is no right or answer, right or wrong answer or way of doing things. If you do it just sitting still, it's okay. There is no one will say, hey, you answering question while you are sitting like whatever. No, there is no way. They are interested in your how you answer the question, how you communicate, how you process the question, and how you express your answer. How is your English language? How is your communication skills? All this you can, if you can portray all this in one shot, like you are sitting and answering questions, that's well and good. For some programs, if you are the one who is working with your hands and smiles and whatever other tools, that will just add things up to your communication skills and way of conveying things, especially with this Zoom thing. In person, it might be a little bit different when you are in front of the person. But using the Zoom, it's only the camera. So you want to use as much as you can of the tools that you have. And when you practice, it will come as a second, like, at your fingertip. Thank you.
Thank you so much, Dr. Nader, for the detailed clarification. Mm. So, do you have any other comment, or maybe we'll go to the update on our projects?
For me, just last question for anyone, like, for tell me about yourself. So all of you, you just agreed not to like highlight your experience. So it would be meaningful what you mean that to speak about the achievement of every period that I had in my life, like every experience that I had in my life. Because I just noticed I just mentioned what I did in my life, but what did I gain from that? So in this part, it's better to speak about the gaining what I gained from this experience. Okay, thank you.
So again, I think it's an important question, and I think it's very important job for you to do, guys, is to find a good answer for this question. But I suggest that you put it in a theme where you want to start with a quality, like what we said, like you can start with, I'm a persistent person, or I'm a team player person, or whatever quality that you want to focus on, so that through the rest of the answer, you will highlight that part. So you will say, and I agree with like, let's say you want to divide your answer into 3 parts, past, present, and future. So you will mention at the beginning the quality, let's say I'm a team worker, or I'm a team player, or I'm resilient. If you focus on that one, then you say, during my medical school, I did this, and I think this helped me advance to the next level. And then now when I came to the US, I found this, and I did all this to improve on, and I joined whatever, and I persisted of doing so and so. And my future, I think I will join, if I join your program, I'll be team leader, I'll be this, and I will add a lot to your program, whatever for that purpose. And in these 3 parts, you can add some of the qualities that also you want to improve or to highlight, for instance. So I think if you want to go by theme, might help you make life easy. Lubab, I think you want to add something. Go ahead.
Yeah, I think it's hard to comment after you, but what you did, what you explained is, I think there is no right or wrong answer for tell me about yourself, but I echo what Dr. Nader mentioned, and for your, you did great, but I felt like you detailed your experience after medical school. You want to say that, yeah, I was born and raised in Sudan, where I graduated from medical school, I practiced there, and I moved to Saudi. I have an experience in across 3 continents. I'm really emphasizing this one because somebody gave me this advice. You have to highlight yourself and tell yourself that you are adaptable. You can inject what Dr. Nader mentioned about that, inject the adaptability in this point. Yeah, I worked in 3 continents because I'm adaptable, and I'm willing to learn the cultures. So talk about more things that not details in your CV, with highlighting the big points in your CV. Maybe you some people, they advise also adding your hobbies in this part of tell me about yourself, because you might line up with someone that interviewing you having the same hobby, and the rest of the interview will be just about what you're doing on this. And you get your good questions regarding that, and you are off the stress. And because of tell me about yourself is all the time the first question, and you will be still nervous about that. So talking about something familiar for you, and you will talk about it relaxed, is more beneficial, I believe. So, but you did great actually. So the way that you approached the question and you answered it, it was good. but I felt like it's more details, and you lost the time telling about the quality that I learned after in the rest of the questions. So that's my comment.
Thank you. And if someone like see that who could like give us a good say about, tell me about yourself, like he well prepared just to see how to look from the start to the end, that would be like helpful. So yeah, if it's possible, if the time allow, Sulafa, because you're the one who's controlling the time right now.
Absolutely, Hiba. Yeah, anyone can go ahead and just give us an example of tell me about yourself answer.
Because I'm someone who learned from examples, honestly.
Yes.
So anyone who is preparing for the interviews, anyone who has made up any answer to this question, please jump in. It shouldn't be a perfect one. Go ahead, whatever you have.
Yeah, and after that, like the group will comment and edit.
I just want to advise people to do it because really it's helpful. For me, I was very nervous to do like in front of 30 people, talking about myself and everyone give me feedback. But I found it really relaxing and relieving and enrich me and give me, more insight about myself.
I can choose from the list. Okay, Dr. Mohammed Tijani, go ahead. Because I practiced before we have a group, before maybe 2 or 3 years, and I know he's great in doing that. So yeah, please, Dr. Mohammed, go ahead and tell me about yourself.
Well, you got me. I was preparing to add a point about something related to the interview, but talking about myself. Okay. All right. Mohammed Tijani was born and raised in Sudan, Northeast Africa, where again I earned my medical degree. Then I practiced there for a few years, then migrate to United States to pursue my dream of learning more about my dream specialty in medicine, which is pathology. Went through different challenges to settle in the United States, but fortunately I was successful to find myself and to settle down to prepare for the USMLE exams. Meanwhile, I got a great opportunity to teach anatomy in different schools. And I moved through this career to the point now I'm a lecturer at more than one university. And I see myself as a pathologist with a great passion for pathology and knowing more about diseases, as well as that by itself can guide even different specialties in getting to the correct diagnosis, as well as a treatment, as well as foundation for all basic medical sciences. That's a quick answer. I was not even prepared for. But I honestly, I love the way Dr. Wiam mentioned earlier that you built your answer for this question of tell me about yourself in the past, current, and the future. I love it. I'm really grateful for that point you mentioned, and I hope each one of us can find a way to build the answer around these 3 dot lines. So it's very difficult to take the microphone from me. I'm a teacher, so this is what I do once I hold the microphone. It takes me forever to let the student go and break. The point I was trying to share with you guys earlier, which is kind of a getaway answer for a lot of debate we had for the last 2 weeks of about your past medical practice, which some of you kind of see it as a disadvantage, others see it as advantage, especially if you're applying for the same field of training you've been through before. Even if it's not, I think it's important here to address the point to these interviewers that practicing medicine in Sudan or any other in different countries is a little bit different than here in the United States. Because first you grad medical school, then it is mandatory to go through the houseman officer training, going through 4 major specialties and 2 elective specialties. After that, you go through being a medical officer until you have the time, until you have the money. And this is important also to pursue your dream specialty. You have to basically rotate through different jobs or different what available jobs at that point. So I believe that can be a good getaway answer if they ask you why you have, let's say, training in internal medicine and you're applying for psychiatry, or why you have training in OBGYN while you're applying for this particular specialty and so on. All right, thank you so much, guys.
Thank you so much, Dr. Mohammed Tijani. It was a great answer. If anyone have a comment on his answer. Just please feel free to unmute. Dr. Hiba?
Yes, thank you, Dr. Muhammad, for this, because now, actually, I'm someone who's interested in psychiatry, and I never have a specific experience in psychiatry, because that's a good point to add why you didn't have like that kind of training while you were practicing, because when I found the job in Saudi Arabia, it's for me as it was mandatory to support my family and myself as a, I'm not going to choose like I need that specialty. It's an opportunity. So that's a good point actually now to add. Thank you. I just wanted to thank you.
Thank you, Hiba. Okay. Lubaba, you have a comment?
Yes, I want to comment about Dr. Tijani's tell me about yourself. It was really great. You highlighted the big points about your achievements until today. Since you're working here in multiple universities as a lecturer, I would like to hear one of the names, just like to make them more attentive to what you're saying. The thing that I felt like it's a little bit long maybe, but you are not prepared to answer this question today as a formal thing, but I felt like it's a little bit long. I think just you need to shorten it a little bit. The other thing, the way you ended it, they always advise that keep the conversation going. So don't like finish the answer and just wait for the next question. As Dr. Nadir mentioned before, you want to give them something that they will follow up with another question in the direction that you want. So you can tell something. That's why they always advise talk about some of the hobbies. For example, if you like to explore new food or stuff like that, or new restaurants, or you like any kind of activity, you're gonna ask them if this is available in the area. So stuff like that. So, but in general, it was really great answer for short notice. Great.
Yes, thank you, Lubaba. Indeed, I will go into the details, full details of what I'm doing and what university is, but just for the sake of this practice, I was a little bit trying to squeeze it. Thank you so much.
You're welcome.
Thank you so much, Lubaba and Dr. Mohammed. Dr. Osama, please go ahead.
Yeah, I have just one like comment regarding for the interview overall. So I don't think it should be too much formal interview, because sometimes one day I found that one of my colleague they asked him about a joke, and the whole interview concerned on this joke. Even the anyone he says that in the committee love and ask him about the detail about it and something like that. So I don't know, is it a good idea to make it like to make the interview light, like to make something like you can say funny or like joke or something like that? Because if it is too formal, I don't think because it will be very boring even for the committee. So I don't know about this idea. So is there does anyone have any idea about this?
Yes, I would like to answer this because this actually happened to me in a real interview. It was in a psychiatry program in a network here called JPS. So I entered to this interview. It was not the committee, but one interviewer. So we made a joke about like personalities, because I consider myself an introvert, and then I have in my family the one extrovert, which is my sister, and we call her Happy Land. And he was like really laughing about this. Oh, you call her Happy Land? And he was joking all over the interview. And by the end of the interview, he actually told me, I just wish you are in this program. I think you're the right person. But for other reasons, I did not end up going to that program for other personal reason. But yes, it is a good, if you have the chance and you feel like this interviewer is has a live personality, and he is actually accepting your jokes and joking about it, I think it's a good thing to be the interview, to be like, believe me, they are taking so much out of this interview, even if you feel it or no. They want to know your personality, your actual person. You cannot fool them, or like like they interview thousands of people before, especially in psychiatry program. That's all they do all day, interviewing people. So they know your personality, and the only way, I think, not the only way, but the best way to know this, by when you lighten up in the interview, like come out about this fake personality that you're trying to bring. That, okay, everybody has their own personality, and they have another one that they want to show, the professional one, that you're this and that. But when it comes to a light interview, then when you open up, and that's why they know the real you. So if there is a chance to do this, I absolutely agree, but not to, if you're like, and make it natural. If it's naturally comes, that's the best thing. But don't make up like jokes, because it's also gonna show up that you are just trying so hard to make this interview light. So go with the flow. If you think that the interviewer are a person that you can give and take, and then you can actually crack jokes and he's gonna accept it, it's okay. But if you think that this person is really serious, I mean, and he's not, he don't want to go that route, don't go that route. But just be emotionally smart. You feel the interviewer. If you think that you can do it, just go ahead. I think you can go that route.
Thank you so much, Dr. Osama and Dr. Wiam, for your comment. Also, Dr. Lubaba remember the interview is stressful for them too. They have other tasks to do. I support keeping it informal if you can. Thank you, Dr. Lubaba. Any other comment? Dr. Sarah, go ahead, please.
Yes, I have a little comment or addition that you can make the interview less formal in case that you have a situational question. So if you don't have a practical answer for it, you can talk about a funny event or fun thing happened to you. So you can achieve two goals, making the interview not very stressful, and this at the same time you show apart from yourself, express yourself in a funny way. So that's my answer regarding funny approach for situational questions, like family members or colleagues or like that. Thank you.
Thank you. So, Dr. Sarah, it's a great point. Thank you so much. I don't think there is more participant raise hand. So, Dr. Nadir, would you like to go ahead for next agenda meeting?
Yes, thank you so much, everyone, for the nice comments and sharing. Thank you, Mohammed, for your answer. I'd like to thank everyone, and let's go for next meeting agenda. Any suggestions? I'm going to share the screen here. So if Azza and her team are available for next week, maybe we can talk about some rejection by journals, the desk rejection or something like that. I think I have we're here. But, tables or four tables with some points. I think article into like a small talk, each maybe 10 minutes, focus on table 1, table 2, table 3, something like that, and elaborate on how we can focus on how we identify the right journal and read about the journal and make sure our goal of the manuscript match the goal of the journal, something like the tips that they mention in there, or the mistakes that we can avoid in these tables. If someone can, or some of the group can talk about that. If you want to continue with interview mocks and tips, that also an option. If people think about SPSS like kind of the basics, we touched on some of these a couple of months ago. If someone can also demonstrate some of any basic method using SPSS, that will give us also some knowledge about the tools that we can use. Any suggestions, anything that you want to add or you want to remove, let me know.
Yes. Sorry.
Go ahead.
Okay.
Go ahead.
I think the blue team will present and the leader will moderate. Is that the...
Whichever way you want to do it, yeah.
Okay.
So someone can present. So I know some of you might be busy. So in your team, see if someone wants to handle this and that, and then
sure.
If you have enough people, that's well and good. If you feel all the team members or most of them are busy, some might do step 3, some might do some other stuff. So maybe you can ask the other groups. So this way is just to organize stuff between you guys, to give you an opportunity to participate and share. And it's just a way of also learning the skill of communication and presentation and so forth. If you have people who are willing to participate and volunteer, that's well and good. If people are busy, maybe you can raise the point with other members as well.
Okay, sure.
Dr. Nadir, also, if it is okay, I contacted Dr. Muhammad Hasaballah to come to present us some interview tips. Unfortunately, he cannot come today, but he said next week he can come. So if you have, we can.
So we can ask him to.
Yeah,
we can ask him to help with this.
He told me he's available next week. So if it is okay, yeah, he will come next week.
So we can give him some. So perhaps we can focus on this part, the interview. So we will do some presentation, maybe 20 minutes, 30 minutes about the articles that we shared. And then we will do, if some people are interested in doing a mock interview, and then maybe Muhammad can jump after that if he wants to add some of his experience. And then if you have time, we can go over the SPSS. If we are busy like today, then we can postpone that for the week after or the week less. So whichever useful for you guys, we are trying to make it for you. Thanks.
Thank you a lot, Dr. Nader.
Okay, I think people benefited from the mock interview, so we will add that as well in the next meeting.
Sure. Sounds good. So we have 25%, 26. Any one of you guys have any update about the project that you are working on? Oh, Lubaba, go ahead, sorry.
No, that's okay. So I guess I want to suggest like something that we can incorporate in our meetings for the future meetings, not necessary to be like those during the interview season, but the critical appraisal part of the meeting that we used to do last year. I think it's really beneficial. People are contacting me now, they're resident, they're doing it, and they're asking about some kind of tips that help them doing that while they're doing the hectic work of residency. So I find it like it's really something that we will really soon we will be encounter in our practice. So I think it's a good idea to have like a specific time each meeting to do that. In terms of updates, we submitted, I believe, 3 abstracts. The rest of the colleagues can talk about that, but we submitted the poster for the presentation for the AMA Research Challenge for the dementia, and I think 2 other if they are available. I am with, okay, yeah, Lena and Sarah can comment on that, but this is the update from my side. Thank you. Dr. Nader is muted, I think.
Sorry, I didn't follow the last sentence. What?
So the update is we submitted the poster for the AMA Research Challenge.
Excellent.
And 2 other abstracts.
Good job. Excellent. Thank you.
You're welcome.
Anyone else wants to share? Go ahead, Ala.
Hello, Dr. Nader, and hello, everyone. Just if you have any times at the end of the meeting that we can discuss the new project regarding the pain management.
Sure. Yeah.
Yeah, just I don't want to spend the time of the other fellows.
So yeah, if you are interested and anyone interested in your team in doing the pen, we can continue after this meeting. So good. Thank you for sharing. Anyone else?
Yes, I have some questions, but I will stay after the meeting because it's a specific question to our project.
Okay. Any other updates about the current projects or?
Yes, I have an update.
Yeah.
Lina Al-Ata finally submitted our poster for the AMA project. And I think Sarah Said did as well. I don't know if she's available or not to comment, but it was submitted before the deadline, the 4th of October. So good luck to everyone.
Excellent. Thank you so much for that, and good luck for everyone, as you said. Good.
Yeah. Also, if Ruba or Abu Zar are not here, just update you with the suicidal rate. Both adult and elderly oral presentation was accepted, and kind of now moving one step ahead to prepare a manuscript for these two papers.
Excellent.
Or to the presentation itself. Thank you.
Excellent. Thank you so much for sharing. That's good. Excellent. Anything else? Any updates? So thank you again, everyone. Thank you for coming over and joining the team and the Zoom meeting. Thanks for your effort, your hard work, and I wish you a wonderful day and a nice weekend, nice night, and see you next week. Let me know if I can be of help. Shoot me an email and we'll be in touch. Thank you.
Thank you so much, Dr. Nadir.
Thank you.
That was so helpful. Thank you.
Thanks.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you guys for the support.
We
Thank you.
can,
Have a nice day.
Thank you. We and
Thank you, everyone.
Ala and the team, we can stay. You can go ahead with your question. Or I can call you later if it's just for you.
It's okay either ways, but I will just give a highlight of my question. Maybe the other my colleague also will help me in this, because now we're in the writing stage. To be honest, I don't have any experience in this part. I just want to organize my thoughts so I can help my team push forward. So now, after we collected the data and we have all the questionnaires from the nursing home, so what is the next step in writing? And the other part of my question: should we all contribute in the writing, or this should be like some people of us is going to be writing and the other half will be editing whatever they write, or how is this going to move forward?
Good question. So basically, what you want to do, you will do a couple of things. I can say like task. So task number one is when you want to write this, most likely we will present it either in AMDA or AGS. So for these two conference or associations, we need to see how they do this. So task number one is to look at previous posters that submitted successfully to these two organizations. So if you can assign someone to look at some of the way, not necessarily same topic, but similar areas of presentation posters, that one way you can do that. The other way is to look at, or the task is to look at the literature. So as a background, see if there is anything mentioned as far as COVID, nursing homes, impact of that on social, on activity, on some of the keywords that you want to highlight. So because in your poster, you want to write about a background, and usually the background will be 2 or 3 sentences, maybe 4. So you will say, for instance, COVID hit the US and the world, and affected the older population mostly, and you can put a reference to that. And then the next point will be patients in nursing homes are affected most among the older population. You can put a reference to that. And then you can mention something about the role or activity impact that has been either you say studied or not studied in nursing homes. So the aim, the next section in your poster will be what your aim of the study. So the aim will be we try to understand the impact of COVID on the activity level and how did the staff in nursing homes handle that, something along this line. And then the next task will be how you can write about your method. So maybe someone of you will look at the methods and will write about we identify certain number of nursing homes using whatever criteria you used, like selecting, and then we contacted them via phone or email. We use this questionnaire and the items in the questionnaire, about 10 items or whatever questions. And then you can mention the response rate. This might be in the results section where you also assign someone to take the analysis of the data that you collected and write about the results. So you will say, we contacted, let's say, 50 nursing homes in Alabama or in Florida or something, and we got response rate of 30 out of 50 or something. And then you can make a table of the most common answers that you found. You can create a graph where you say, for they use iPad in family contact or bars graph, or and you want to present that. And then the last section or task will be how to bring all this together in the discussion part. So you will say maybe 2 or 3 points that COVID affected this section of people and staff in these nursing homes, like the major ones. And then you can add last part is this area need to be investigated more, and maybe we can help patients in the future, something like that. And then this is the poster kind of key areas you want to. So you will ask your team who is willing to work on the background, who is willing to work on the data analysis and writing about the methods and the results, and who is willing to work on the discussion part or the conclusion part. And then you will put in your poster the references or the acknowledgement or the support that you get for the work, mostly from MSU with the award that we got, something like that.
Okay. Do you advise looking at the poster and or a similar poster and work backwards? Like look how the poster is going to be presented, and then look backwards and assign like assign tasks accordingly.
Yeah, I think you can do that. Yeah.
Okay. Yes. Inshallah,
and in the app, we have some videos about how you do poster. You can look at posters before. You can ask the Sarah Krupa and the people who submitted their posters. Now they can also share the PowerPoint, and you can look at that also as far as how to format the things.
Okay. 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 Thank you very much, Dr. Nadir. Thank you for your help.
Thanks. Yeah. All right, Ala and her team. Al-Wali, you have question or comment?
Yeah, actually, Dr. Nadir, me and Wiham, we are the same groups. Just I'm writing things down. So just I want to make sure just I get down what you said. So you mean like, so the whole thing is going to be like a poster, abstract face. You're gonna
So the easiest way to do it is using, submitting it as a poster.
Okay.
And for this level, I think poster will be easier to accept and submit to more than one. It will not take long. If we want to convert that into a manuscript that we can submit to a journal, it's another phase, another jump kind of, because it will take a little bit longer time. So that's also a possibility. We can talk about that later. But for now, let's do it as a poster.
Thank you, Dr.
You're welcome. All right.
Hello, Dr. Nadir.
Hello, go ahead.
The last week we discussed the pain management projects with the group, and we agreed to focus on the difference in the pain management before and after COVID rather than the pain assessment. And what do you think and what is your feedback regarding the research questions? It's better to focus on the management or in assessment, or how regarding that?
No, I think management is a good option. So you can try that, and it's a great topic.
Okay.
So.
Okay. And regarding the type of the research, I don't know if it's you agree to do it like a systemic review, or if you want to do it a retrospective cohort study, what is our option to do it? Or
I think a review might be a good option. It's gonna be faster, and hopefully you will have the data. And even if you don't, at least you will have the methods, and you can submit a sketch poster if we have a deadline, and then you can get this data later and analyze and finalize things. So yeah, I think a review might be a good option if you can do that.
okay, and what is the next step? I don't know how we could collect the data and
so
how the sample size or the data that we have to collect it. And
yeah, so for the review, you can see how Lubaba or Sarah Said or Krupa, they have similar projects. So what you need to do, I can forward you a sample of one, let's say, poster or some, where they looked at the literature and then how they collected whatever they found, and then include and exclude some of these, and then reviewed what happened there, and then come up with a final recommendation on what happened.
okay, and anyone of the group have any questions? Just go ahead and ask Dr. Nader.
Go ahead, Al-Wali, Dr. Al-Wali.
Yes, Dr. Nadir. Actually, last time during discussion, we kind of just narrow the topic. So the first we said like assessment in general, and then we come down to pain management before and after. So and now you mentioned that we have to go over the literature, review what's going on there, and then kind of
so it's a systemic review, right? If you want to do it as a systemic review, or like you look at what in the literature, how many studies, if there is any studies done as far as management of pain in nursing homes in the past, and how many they are done during COVID or after, and like nowadays, and then you can identify how many studies in total. You look at this and see if there is any changes, if there is any new findings from recent studies about management, any changes, updates, and you can write about that. That's one way, unless you have different ideas when you discussed it.
Oh, yeah, actually, yes, I wanna just kind of clarify a little thing. So when we, as a systemic review, and when we just trying to include or inclusion criteria, so we're gonna say, for example, like we exclude this type of study, and we have to provide explanation for that. Yeah.
Yeah. Yeah.
Okay.
Sure.
Okay. Thank you.
You're welcome. Any other questions, any other comments, or anything unclear for you?
Yes, doctor. You said we have to do it like as a poster presentation. Do we can it like abstract or manuscript, or will be the next steps after the poster presentation?
The abstract itself is what you want to like. So when we submit it, we have two options basically. Option number one, the easiest and first one is abstract.
Okay.
And it'll be sent, let's say, to AMDA or AGS for executive presentation. You will present it this way. The second way is to, from the start, if you want to write it as a manuscript, you can start writing about it. So, and you identify which journal you want to write about, the same methods that you want to do. You want to do the literature review, your method, your findings, analysis, and then your discussion and final comments. And then after you've done all this, you submit it as a manuscript to the journal. Sometimes they accept it, sometimes they ask you for revision, or sometimes reject it. So this way is kind of a long way. It will take longer time from you guys, and it will take longer to submit and back and forth. So it's an option. We did it in the past, and some of the other projects we submitted as a poster. They got accepted, and now we are turning that into a manuscript. So you can do both with the same project. So.
Okay, thank you. Yeah, great approach.
Excellent. Okay, Alwali, you have a question?
Yes, this is just kind of notes to Dr. Ala. And just my suggestion is if she could kind of, you can just arrange a meeting just to kind of, when we go over the stuff as early as possible, everything we have it in our hand after the discussion. So a days or 3 days later, we lose everything. We kind of struggle, try to remember what Dr. Nadir said.
Yes, sure.
Okay.
Thank you.
Sounds good. Any other questions or anything unclear? If not, then let me know if you have any other questions later. You can send me an email and or text message. I'll be happy to come in contact with you guys. Thank you. Have a wonderful day, and I wish you all the best.
Thank you, Dr. Nadir.
Assalamu alaikum.
Thank you.